Miebo is a prescription eye drop used to treat the signs and symptoms of dry eye disease. Miebo works to treat dry eye disease by preventing excessive tear evaporation. Miebo contains perfluorohexylactane, a semifluorinated alkane that works to stabilize the tear film on the surface of the eye, stopping the tears from evaporating and preventing drying of the eyes. It is not known if the medicine is safe and effective in children under the age of 18. Indications. It is used to relieve dry, irritated eyes. Perfluorohexylactane works by keeping the tears from drying up. This keeps the eye moist, helps protect the eye from injury and infection, and decreases symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. How to use. Use this medicine exactly as prescribed. The recommended dosage is 1 drop to be instilled into each eye 4 times daily. Remove contact lenses before using the drops and wait for at least 30 minutes before inserting. Administration instructions. Step 1. Remove the cap from eye drop bottle. Step 2. Holding the bottle upright, gently squeeze the bottle. Step 3. While squeezing, turn the bottle upside down and release the pressure. Draw an air into the bottle. Step 4. Keeping the bottle upside down, place the bottle above your eye and squeeze it again to release a drop into your eye. Usual other dose for dry disease, 1 drop into each eye 4 times daily. Contraindications. Before start treatment, tell doctor if you are using any other eye drop. Wear contact lenses. Pregnancy. Tell doctor if you are pregnant or plan to become pregnant. There are no data for Miebo use during pregnancy. Breastfeeding. Tell doctor if you are breastfeeding or plan to breastfeed. There are no data for Miebo use during breastfeeding. Talk to a doctor about the best way to feed a baby during treatment. Precautions. Before using perfluorohexylactane, tell doctor or pharmacist if allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before using this medication, tell doctor or pharmacist your medical history. After you apply this drug, your vision may become temporarily blurred. Do not drive, use machinery, or do any activities that requires clear vision until can do it safely. Side effects. Eye redness or temporary blurred vision may occur. If either of these effects last or get worse, tell doctor or pharmacist promptly. A very serious allergic reaction to this drug is rare, however get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue or throat, severe dizziness, trouble breathing.